To praise or not to praise? That is the question. Praising. Praising is, I don't want to say problematic, but it's controversial issues. Some people believe 100% in praise, some people don't. Um, Praises has lots and tons of different type and style and mechanism of action, and uh, mechanism of formation and measurements. Praising is controversial also with the insurance company in USA, for example. Not the case in Europe, but USA and along with all other countries that they don't even have a praising system. Praising is scattered all over the world with different types and styles, and uh, cost effectively is also controversial because uh, it's not cheap device to deal with. Generally, praising is um, very critical issue because this modality on the last I will say 10 to 15 years, the breakthrough through the praising, of course it was invented earlier than this, much earlier, but the breakthrough in the last 10 years and the literature support for praising the scoliotic patients and the outcome and the results on the literature and scientific paper are amazing. It gives us a chance to interfere with the patient non-invasively and reach some great results supported by literature. So praise is, I put some, of course we have the soft praise, the rigid praise, the very rigid, the static praise, the dynamic active suits and stuff, praising, and I just put the names here that the Boston, the most famous, used to be the most famous praise in USA and all over the world. The TLSSO, the Milwaukee, the Charleston, Providence, Rosenberger, Sovresco, Rigoccino, Sipilla, Leon, the BSP, the Wilmington, Jensingen, Art, Scully Care, Trea C, Spine Core, the Tyler, the ASS, all these names, every single scoliotic clinician or physical therapist or surgeon, some of this name passed and flashed his mind through the scoliosis trip and scoliosis management trip and experience. Those are praises from all over the world, from different categories in pricing, in manufacturing, in technology. Some of them are very advanced, some of them are very complicated to obtain, some of them are simple. How do we judge the praise? How we do judge the effectiveness of the praise? This, we're gonna talk about it in the next slide. And of course, we have the unknown praise, the praise that are manufactured domestically with some orthotists, and most of them have no clue about what they're doing. And if it's not supervised with some scoliotic specialists, which are also don't exist in so many countries, or most of the countries actually, a bad brace could be catastrophic. A bad brace is much worse than no brace. No brace is 100% better than bad brace. And now, how do we choose the brace? To choose a brace, you have to obtain the proper diagnosis, the right diagnosis. Scoliosis is a multifactorial with lots of different etiological pathways and pathogenesis that leads to scoliosis. There's tons of hundreds of different types of scoliosis. You have to have the right diagnosis for your scoliosis disorders. After we reach that, we choose a brace according to necessity for this case. Is it important? How much important? Does it combine with different modalities like exercise or certain sports? How long? We talk about the details, the necessity of this particular brace for this particular patient, the availability of certain type of brace on certain type of countries or certain places, on availability on my area or my country, or access to this particular brace technology with all different types that we mentioned earlier. Effectiveness, how this particular brace that I choose among all the 30-40 bracing styles that are available in the world, which one is more effective to my case? Effectiveness. And of course, the cost. Does my insurance pay for that? Unfortunately, USA, that's totally different political on a side, but in USA, they don't cover the bracing for scoliosis. Europe, they do. Other countries, it varies. You can have a brace from, I will say, $200-300 all the way to $7,000 or even more. Costs is very important issue for certain countries and certain families. What's our target with this particular brace? Is it stabilization brace? Is it correction brace? Is it postponing buying time brace? What's our strategy to apply this particular brace should be discussed as well. So to choose the right brace, you have to think about those factors: the necessity, the availability, effectiveness, and cost, and target, and our aim in this particular patient. Mechanism of action, you can always reach now. It's open world now, and everything is literally online. Mechanism of action, some patient work on the elongation and the dilatation, or the dilatation or pulse, and some of them stabilization or mobilization, static versus active, correction versus stabilization, for example. What kind of brace and what's the mechanism of action on your tip of your fingers? When you get prescribed with a brace, just see what's the mechanism of action, what's the advantage of this brace versus what's the advantage of Sovresco brace, the very rigid versus Providence brace, for example. What's the advantage of Scolicare versus the Shinorigo? How much is this? How much is that? What's the mechanism? Just refresh your mind, because you're going to be on the brace for a while. The brace management usually takes a minimum 18 months to up to 3, 4, sometimes 5 years. It is a very intimate friend that you're going to have, and you need to know everything about what you are carrying or what you are wearing. And this helps a lot in compliance when you understand why we are prescribing a brace for you. This could prevent you, and in the most of cases it's prescribed to avoid you from surgical intervention, which is not a joke. It's so serious business. It's extremely serious business in medical field. Opening a patient, and especially on the vertebral column level. Prescription and measurement and manufacturing and fitting and compliance. Prescription, as I repeat this, and I cannot emphasize this a lot as I want to, prescription, why and when and how I'm gonna prescribe a brace for you. Measurement is very professional thing, need to be done with a specialist. Also manufacturing, even in all different kind of bracing, manufacturing is very, some manufacturing are 3D with lots of new technology now, especially in the measurement and the manufacturing together. Fitting, the process of fitting and the patient wearing the braces and the fitting, and make sure everything is fine, make sure it's non-painful here or there. All this figures and all this different factor will takes you to a good compliance. The patient will not suffer from the brace. It will be a good friend for a good trip, long trip, for management, 2 years average, 2.5 years, but the compliance will be perfectly, because compliance is so critical for the prognosis. The brace effectiveness evaluation, usually done in the first 2 months after the braces are obtained. We do in-brace X-ray to evaluate, are we in the right track or not? Then we follow by 6 months or a year evaluation and visitation for the office. So also prescription versus a contraindication. There's tons of contraindication for the bracing. It's a list. You have to, I've seen some BTs just ordering bracing with no idea about the contraindication. That might lead to a catastrophic collapse of the patient. So make sure the contraindication of the bracing, you are not one of the contraindicated persons or patients, and you don't have such things. For example, flat back. Flat back is contraindicated, red line, no bracing. For example, the perpendicular ribs, on the lower perpendicular ribs on the ilium crest, that's contraindicated for bracing. Also, the last thing is the casting. Time buying in the EOS scoliosis, early onset scoliosis, casting is a very important procedure that's be done, unfortunately, under anesthesia, but it's so important, and it has a time frame around the 2 years. We try to do it not before the 2 years, after, and try to buy sometimes for the surgical intervention, which will come in 3 or 4 years old. And casting and surgery, usually casting is a serial of casting. It might take like 4 to 5 casting within a year or so, but it's very important, very important technique for, especially for the early onset scoliosis. And also casting could help on the adult scoliosis, and we might have a chance if someone interested. The only disadvantage that it's not available in all the countries, especially the developmental country and third world country, it doesn't exist. But it's one of the modalities that it's amazing on the early onset scoliosis, congenital and syndromic scoliosis, and it has some protocols and indication. We can always talk about it in details later. Again, this channel is for all scoliosis healthcare providers, the BTs, MD, and DCs, etc. And we just try to fill the gap among different scoliosis clinicians through the scientific literature. And thank you so much for listening, and I will see you next time.